So you see the big screen, right? Thank you very much. First, I would like to thank the organizer, and especially UTAM and the Nepal Flying Lab for the invitation and for the opportunity to be here with you. My name is Olivier Defawe. I work at VillageReach, and I am in the private sector engagement. And for the last 7 years, I created the Drone for Health program, and I am leading the Drone for Health program. Just a word about the organization VillageReach. VillageReach is 22 years old, and our mission is to transform the healthcare delivery to reach everyone. And because we aspire to a world where everyone has the healthcare needed to thrive. And so to do that, we work with governments, we work with the private sector, we work with academia to test innovation. And by innovation, there are technological innovation, but also training, new policies, and so on. And we test them in order to define new pathway to primary healthcare, to increase the access to product to people whenever they are, wherever they live. And we do it in a way that we ensure the sustainable impact. And so for the last 7 years, VillageReach has decided to explore the use of drone to strengthen the public health supply chain. Because we believe that the supply chain of the future is really going to be based on fit for purpose mode of transportation. It is not about drone replacing the truck, the boat, the motorcycle, the bike, but drone we see it as an additional mode of transportation that is fit for a certain context. And this is, you see here on the screen, really the complexity and the variety of mode of transportation from national level to provincial level to district to health facility level, so middle mile and last mile. And we believe that drone as an additional mode of transportation as a place to play. And we also think, and I'm going to present some data that shows that drone also have the potential to really transform how advanced strategies like vaccination campaign can be rethink, can be optimized. And you have a figure on the right, which is in Africa, in the Democratic Republic of Congo, where during the yellow vaccine outbreak, the government, the UNICEF and WHO had a mass vaccination campaign. And instead of carrying all the vaccine for a week at a time by car for 4-hour journey for one of the vaccination points, another 3 hours by boat to another one, or another one here for about 10 hours by boat, well, we were able to provide, using drone in 20-30 minutes, fresh vaccine, fresh product, multiple times a day. So you can imagine how it really helps simplify, from a logistics standpoint, all the operations of that advanced strategy, in this case, was vaccination campaign, and also optimize where to deploy the cold chain equipment. So this is why VillageReach 7 years ago really thought we need to see if drone, that's when we started the journey. And today in Africa where we work, really we can say that there is 4 drone transport service that are at scale in Africa. And I insist on the word scale. We're not talking about pilots, we're talking about long-term, big geography of a deployment for many years. And this is probably the well-known, the Rwanda and the Ghana with the plane, but you also have some large operation in Madagascar, in Malawi, and in the Congo, DRC, for the Democratic Republic of Congo. In Malawi and DRC, this is where VillageReach is providing the technical assistance to the government and to the private sector to integrate the drone into the health system. And there they were using Swoop Arrow and Wingcopter. Today, all those larger deployments that I just mentioned really allowed us to generate the evidence of the benefits that drone can have when integrated into the public health supply chain. We have evidence that there's a decrease in stockout days. There is a decrease in transport time. There is increase of availability of product at the last mile. In Mozambique, we shown data showing that there's actually the quality of the sample is preserved. In this case, was sputum for tuberculosis is preserved as well. So therefore, now the government is using drone to carry samples. But I want to bring your attention on, you see here in DRC, is the last in DRC coverage is actually a decrease of coverage. Well, we must keep in mind that drone is a mode of transportation. So to impact, for example, the coverage, which is the percent of people who have received specific vaccine, there is more than to make that health outcome. There is more than just a mean of transportation. You have to have the right service at the health post or the health facility. You have the health worker have the right training to provide the right care. So during the study that we did, a 2-year study that we did in DRC to evaluate the benefit on the supply chain performance, the supply chain cost, as well as the health impact, we saw that the coverage actually was not affected, if anything decreased, but that's due to other events. There was a strike of the healthcare workers and so on. That is nothing to do with the drone, which is just an additional mode of transportation. So when you want to look at health outcome, you have to be careful to match one-to-one, a direct correlation with the drone versus life-saving. If you use a drone to transport blood because of an accident or an antivenin, you can do a one-to-one correlation, direct correlation with a life saved. But keep in mind that drone is only an additional mode of transportation, and so the health impact is not necessarily direct, but maybe you have to use proxy indicators. Today, after about a decade, there is still a number of challenges, and VillageReach over the last 7-8 years has developed some mitigation actions for those challenges. The technology is still at a very nascent stage. There's still a lot out there of drone manufacturer, OEM, or drone transport service provider who is still at the R&D stage. Let's not forget that. And so you always want to make sure that when you are looking at integrating a drone transport into, for example, the public health supply chain, you really want to approach it very carefully, do a global request, a global type of tender, and have an extensive evaluation of your technology and and really test that technology in the context, because he may work in US or in Europe or in Australia, but that doesn't mean it's going to work actually where you intended to. So VillageReach has developed protocol to develop tenders. We develop a network of experts in different area in order to really do a very thorough evaluation of any type of drone technology. Authorization, straight people think about, yes, you need a civil aviation, you need authorization to fly. Well, yes, of course, but there's way more than that. And you start realizing that as you start doing the work and implementing in countries. Air traffic control, also different set of authorization. Customs, importation, those are all authorization that you have to have beside the authorization to fly. You need to have also authorization from the health authorities and so on. And so VillageReach has developed a co-creation approach, working hands in hands with stakeholders from the different sectors, aviation, security, defense, transport, health, and so on, to develop the SOP, the regulation, the guideline, and so on and so on. And another approach that we use is to help government develop national and subnational drone commission to review every work around drone in the country. Acceptability, there is still a lot of misinformation out there. And so VillageReach, every time we go to a new country, a new location, we do a perception study. And based on the result of that perception study, we develop our communication and sensitization strategy and content. And we tailor it based on the result of that perception study. And we don't do that just at the beginning. Sensitizing the community, doing a lot of community outreach to sensitize about drone is an ongoing activity, not just at the beginning of any implementation, but really an ongoing. And that is often undermined. Finally, sustainability. And I have I'm going to be digging into the detail of sustainability, financial sustainability in a moment. So we're just mentioning that, you know, it's still very early on. Drone logistic in the public health is absolutely not financially sustainable as of today, as far as all the study that we've done and the at scale deployment that we've done. And we think that is because of the monosectorial market development. And we are testing right now a multi-sectorial market developments, which I'm going to talk in a minute. So overall, over the last 7 to 8 years, VillageReach has developed a know-how from assessment, design, network design and planning, getting all the different type of approval, all the setups, and then the ongoing operation. And then let's not forget, it's all about continuous improvement. So it's constantly improving. And so we've done that in 5 different countries through our 7 drone program with many different drone service provider. So we have developed some tools and some guidelines that are available for everyone. And I will close this presentation with showing you where to access those tools. And this is how VillageReach as of today is actually overseeing drone transport operation in 3 countries in Africa: Democratic Republic of Congo, Malawi, Mozambique, and providing technical assistance in Central African Republic, Kenya, and in DR with actually the Dominican Republic Flying Lab. That was a couple of years ago. I want to go into a little bit of detail on some of the lessons that I think is going to be really helpful to anyone who's looking at integrating drone into the health supply chain. And to do that, briefly, the network in DR Congo It's in one province, in Equator province. And as of today, for the last 2.5 years now, it's been a fleet of drones flying days in, days out, 7 days a week, resupplying for 40 different health facilities that are the hardest to reach, where the traditional health supply chain is breaking because it's too remote and the infrastructure, the road infrastructure are non-existent or very poor. And it's actually the largest bi-directional two-way, so delivering and picking up, the largest bi-directional drone network in the world, over 37,000 square kilometer area that this fleet of drone is serving, with a main hub and 2 satellite hubs to recharge the battery for longer distance. From bottom to top here, it's about 350 kilometers. So you cannot do that just with one set of batteries. So we found some strategy for that. Looking, and for 2 years, we did an extensive study with baseline data, looking at before the introduction of the drone into the health supply chain. And we call it end lines. It's like after 2 years of operation with the drone integrated into the health supply chain. What kind of result do we see? Well, as expected, from a impact or benefit for the health supply chain itself, we see drastic increase of, for example, vaccine availability. This is just example of indicator, but we have about 45 indicators that we measure. Vaccine availability go up, stock code go down. Polio sample transport who are now reaching the lab for testing within 48 hours, which is 48 to 72 hours, which is the guideline from WHO. So great results from on the supply chain performance, which is reflected with the effectiveness score. The effectiveness score helps you to measure the effectiveness of your supply chain to deliver an outcome. The higher the percentage of your effectiveness, the more the supply chain is effective at reaching an outcome. But when we looked at cost per dose. In this case, is vaccine. The study was just done with vaccine, but we transport any kind of product. But the actual costing and cost effectiveness study was done with the immunization supply chain. We see an increase of about 3%, or 3 times the cost of a dose of vaccine when you have your supply chain with the drone. Well, this is expected, right? Because the cost of new technology is historically higher. Think about cell phone or solar panel. The cost was prohibitively high when the technology was first introduced. But remember that the supply chain performance increase once we introduce the drone. Now, let's look at the cost effectiveness. The cost effectiveness of the current supply chain at the end line, so the supply chain with the integrated drone, has a higher cost per unit effectiveness, which means that it's, as of today, the way it was designed at the end of the study show that it was actually not cost effective. It costs more to reach effectiveness than a baseline before the drone was introduced. But because we saw an effectiveness again in the effectiveness, remember, for example, we went from 21% effectiveness to 48%, much increase. We started looking at how can we optimize, improve the supply chain with the drone integrated into the supply chain. And sure enough, after addressing some of the operation bottleneck, when we increase the assets utilization, we saw that the cost per unit effectiveness is actually lower than at the baseline, which means better cost effectiveness. So all in all this tells us that integrating drone into the health supply chain has benefits on the supply chain performance and can be cost effective if well designed. And so since then, we have optimized the design. We resolved a lot of bottlenecks that we have identified, increased the effectiveness, and now the cost effectiveness of the current supply chain is actually cost effective. I want to spend a few minutes remember I told you earlier that the use of drone transport in the public health supply chain is not financially sustainable. And you remember that most of the work around drone logistics has been really narrow for public health application. So very narrow market focus. And that has resulted with a lack of understanding of how and if drone logistics can reach an affordable price point that makes sense in low and middle income countries. And so we at VillageReach and globally, we're spreading the word that we have to transition from a monosectorial market development to a new market development strategy, or one that is based on entering multiple markets simultaneously. We need to go from a customer from the public health only with a single customer paying for all recurring costs, one pricing strategy, small scale, so no economies of scale. We need to transform this to become more cost competitive and sustainable, and having a sustainable pricing for the public health market. So that means that we need to enter the public health, the private health, as well as many other sectors. And so we have multiple customers to spread the fixed recurring cost among them and use a market-driven pricing strategy. That is what we believe will help make drone logistics affordable to the public health sector. And we're doing that in DRC, Mozambique, and Malawi by approaching the various ministries and laying the use cases of the use of drone to be able to really enter various markets simultaneously and use different, very sophisticated pricing strategy and apply some subsidiary approach, for example, from more profitable sector to less profitable sector, like the public health market. I will finish just by saying just the very simple key takeaways. Drone operation demands a complex ecosystem. You have to work to see and work hands in hand with stakeholders from various ministries, various sectors. And VillageReach likes to do that by developing working group, national, subnational drone commission, a drone working group, where all the parties are there together and developing the journey together. And we work hands in hand with the regulator, helping them develop, adapt the local regulatory. We even make some south-to-south exchange. We organize trips from civil aviation from a country that does not have yet drone regulation to a country that is more advanced, so they can learn from their peer. We also develop a methodology that starts small, but little by little you start growing and you start looking at different indicators of performance as you scale, both geographically and you scale, you sustain over time. And really pushing really hard, drone is there to complement and not replace existing mode of transportation. Just think about fit for purpose mode of transportation. And finally, health sector cannot be the only market.
Recording stopped.
It will not be sustainable. So you might as well, from the very beginning, start developing a multi-sector market development. And this is it. So VillageReach is there. We are a partner of Flying Lab. We provide different support to different partners, like I said, government, public, government, private sector, and academia. And so do not hesitate to reach out if you have any question, comment, and need help. And here you have the UAV for Delivery working group where you have all the resources. Thank you very much for your attention.
Thank you, Oliver. Thank you, Mr. Oliver, for joining us today. It has been honor to know your insightful thoughts and years of experience. We also appreciate you for joining us from 1,000 miles away from us, from different time zones, and make this happen. Now it's time to have QA sessions on keynote speech. Anyone from audience can have interaction with our keynote speaker, Mr. Oliver. The platform is open for all. That's it. अब चाहिँ हामी क्यूए सेसनमा प्रवेश गरेका छौं। कीनोट सेसन स्पिकरहरुमा भएका जिज्ञासा, प्रश्न एवं केही छन् भने हामी ऑडियन्सबाट डाइरेक्ट इन्टरेक्सन सेसनमा प्रवेश गरेका छौं र तपाईहरु बीच कोहीसँग कोही जिज्ञासा छ भने हाम्रा प्राविधिक मित्रहरुले माइक पुर्याउनु हुनेछ।
Thank you, Olivier, for your delivery. I mean, the noble work that you guys have been doing in sub-Saharan Africa is quite commendable. In a state of Nepal, where the terrain, especially the remote areas, are mostly in mountainous areas. So if VillageReach were to work in Nepal, how would you face such challenges if you were to work in Nepal? Because in sub-Saharan Africa, I guess it's mostly flat lands, but in case of Nepal, it's mostly hilly and mountainous regions. So in terms of altitude, also it's kind of difficult. So if you can provide a little more clarity on that side, it would be great.
Should I respond now or should I wait for more questions?
Yeah, we will wait for another questions, and at last, no, we can interact with individual questions or individuals queries. You can
okay.
have, yeah.
So VillageReach is make the link between the public sector and the private sector. In this case, the private sector being a drone service provider or drone manufacturer. So Nepal, yes, has more mountains than sub-Saharan Africa. We do have mountains, so we do also work with drone service provider and drone manufacturer who have to adapt to that mountainous terrain. So it's all about selecting the right drone technology, the OEM or the drone service provider. So if we were going to work in Nepal, we would make very extensive evaluation of the drone provider or the drone technology in Nepal. We had very unfortunate event when with provider who, you know, showed how performant or well they were performing in Asia, in Australia, in Europe, in the US. But then when we brought them where we want them to operate, the solution was not robust enough. So localization, big localization is the key. And during a very extensive evaluation of the technology and the performance in the in situ situation. One thing that I can maybe that adds to what you ask, and we learned that over time. Okay, we always in Africa, but for you have seasons, right? Rainy seasons, cyclone, Mozambique, Malawi. Right now they're being hit by cyclones, and there's a misconception that the drone can help you during those moments. But actually, during the rainy, they're not able to fly. If it's big winds, like I'm talking like big winds or big torrential rain, they cannot fly there. Okay, but the roads are washed, and you cannot also transport things by ground. But the drone has its limitation, and you have to take that into consideration in your planning. But as soon as you know the between rains. Or right after, you can start flying much quicker than that transporting via road.
Just to add on to my question, I just wanted to know, you know, when you are operating in sub-Saharan region, what sort of bureaucratic hassle, especially with the government agency, you guys faced? If you can, you know, list it as 1, 2, 3. Then that will all be also very helpful for Nepal as well.
Yeah, actually, because we start from the very beginning with, for example, the civil aviation. Like we designed the project together. We involved them really to the day-to-day discussion at first planning. The civil aviation it's not too complicated to navigate. What is a little more complicated is dealing with national security. That is a little more challenging. So the civil aviation, if they are eager to test that innovative technology in a safe way, and you together co-create the path forward to test that innovation together, that's usually it's not a problem. But like I said, there is many other agencies that you have to deal with. So national security is one, who usually depend directly to the president. That means that you have to deal with the prime minister and the office of the president. That's a little much harder to work with. But, you know, it takes time. It takes time, a lot of bureaucracy. Another one is about the Office of Importation. I don't know how in Nepal it works, but the importation is very complicated. And we didn't anticipate that. We didn't. So now we know how to, we anticipate, because now we have that experience, we anticipate what kind of challenges we're gonna be facing with the importation, for example. We have work around it. But it was a very steep learning curve that we didn't plan. So if you start, importing is gonna take time to figure it out.